Hi, good afternoon, everyone. My name is Ash Carey, and I'm president of the Medical Oncology Association of Southern California, also known as MOASC. Today, we are highlighting research from one of our fellow colleagues in Southern California. This is part of the Researcher of the Month that we will be performing monthly. Today, we're very excited to acknowledge Dr. Sandip Patel, Associate Professor of Medical Oncology at UC San Diego, who's leading their field of experimental therapeutics. He's also a director of the Clinical Trials Office and Deputy Director of San Diego Center for Precision Immunotherapy. Welcome, Dr. Patel. Thank you so much, and congratulations on your ongoing cancer research.
Thank you so much, and thanks for what you and MOASC do for our community and for our patients. It's great to be joining you.
Well, thank you so much. Dr. Patel, our focus today is to try to learn about what you're finding most exciting within your area of research, within the area of lung cancer, which I think is where you focus most of your work in. Tell us what's going on and what you'd like for us to learn.
Absolutely. Coming back from ASCO, in which it's drinking from the fire hose in terms of new clinical research, there are multiple clinical trials and avenues that I think are exciting. I think the theme that we've seen is that precision oncology, biomarker-directed approaches have tended to be more successful, and we're currently in a renaissance of antibody-drug conjugates, for example. Trastuzumab deruxtecan, which is a next-generation HER2-targeting ADC, had a standing ovation at the breast cancer discussion and has amazing activity also in lung cancer and other types of cancer as well. And so this is one of the studies we're excited about. Additionally, now that we have these targets, thinking about living drugs and cellular therapies. And so we're opening up next generation CAR T-cell therapies in solid tumors, for example, targeting HER2 that utilize some built-in safety switches to ensure that we can maximize efficacy and minimize toxicity. And so I think the ability to find the specific biomarker, really delivering on precision oncology, not only for targeted therapies such as small molecules, including addressing resistance, but also some of these cellular approaches that now let us really effectively and durably control cancer, whether it be HER2, whether it be tumor-infiltrating lymphocyte therapy, in which we take out the patient's lung cancer, grow out the immune cells, and reinfuse them back as a living drug, or whether it's these antibody drug conjugates, which for a while were really quiet, but we've really entered a renaissance of these drugs. The ability to get that molecular profiling and be directed to the proper clinical trial, whether it be precision targeted therapy or precision immunotherapy, is really what I'm most excited about, and really what we've seen at ASCO move the needle for our patients.
I think that what you're saying is spot on. It looks like we're just scratching the surface in areas that we've come so far and we've seen so much of achievement in, but it looks like the opportunity to grow that is much greater, and that's just wonderful news for our patients. I wanted to focus next on some particular areas within your area of cancer research, particularly focusing on any clinical trials that you either have open or are looking to open shortly, that our audience would be interested in learning more about, and perhaps even referring patients to.
Absolutely. And so a couple clinical trials that are really exciting for us. One near and dear to my heart is SWOG 1609 DART, which is the rare tumor immunotherapy study, for which we're looking for patients who are have PD-L1 genomic amplifications, hypercalcemic small cell cancer, the ovary, which is rare ovarian subcancer subtype, as well as a couple other tumor types that are rare of interest. And so if you're able to ask your oncologist, if you have a rare cancer, if that dual immunotherapy study is for you, we're able to bridge that communication. And this study is open at over 800 sites, so it's probably close to home. Additionally, we have clinical trials testing next generation inhibitors of PATCH1, for example, cellular therapies targeting HER2, and new approaches to tumor-infiltrating lymphocyte therapy, in which we try to take out the immune cells that have fallen asleep within the tumor microenvironment, basically set them to boot camp outside of the body and reinfuse those immune cells back into the patient, and doing this in interesting ways to maximize the response. I think these are some of the studies I'm most interested in. And so for patients who either have a rare cancer or who have a cancer for which standard therapies have not yet worked for them. The idea that we have studies ranging and running the gamut from targeted therapies, targeting HER2, BRAF, PATCH1, for example, that are really next generation agents that are moving the needle, all the way to cellular immunotherapies, CAR T-cell-like approaches that either have specific targets or are pan-tumor targets. We'd be very keen to try to help patients in any way we can, from really taking our work from the bench to bedside to our community to really positively impact our patients.
That sounds very exciting. I think that it's very important to identify the appropriate target, which is something that I think that our patients are now understanding why we're so keen on trying to obtain tissue or liquid biopsies to continue to identify these markers, which sometimes can be moving targets. Thank you so much for spending this time with us. We look forward to hearing more from you, and we'll go ahead and talk to you soon and look forward to future endeavors together. Thank you so much on behalf of MOASC.
Thank you.